Imagine enjoying a sunny afternoon outdoors when, days later, a sudden fever, chills, and aching muscles leave you bedridden. What if these symptoms are more than just the flu? You may have fallen victim to a pair of stealthy tick-borne infections that are often overlooked but can have serious consequences if not treated promptly. Today, let's dive into the world of Ehrlichiosis and Anaplasmosis, two diseases that hide in plain sight, waiting for the unsuspecting. Ehrlichiosis and Anaplasmosis are bacterial infections transmitted by ticks, and while their names might sound unfamiliar, their impact is significant, especially in certain parts of the world. Both diseases share many similarities, from the way they're spread to the symptoms they cause. But there are also important differences that everyone should be aware of. Understanding these diseases is crucial, particularly for those who live, work, or play in areas where ticks are common. Let's start by exploring the symptoms of Ehrlichiosis and Anaplasmosis. Most people infected by these bacteria will notice symptoms appearing suddenly, typically about 12 days after a tick bite. The onset is often dramatic, leading quickly from feeling fine to feeling profoundly unwell. Common symptoms include a high fever, chills, intense muscle aches, weakness, nausea, and sometimes vomiting. Many patients also experience a persistent headache and a general sense of malaise, a feeling that something is just not right. While these symptoms are similar for both diseases, there are subtle differences. In the case of Ehrlichiosis, some patients develop a rash that may appear on the torso, arms, or legs. This rash is much less common in anaplasmosis. However, it's important to note that not every patient will experience a rash, and some may have no symptoms at all, making it easy to overlook these infections. For most healthy individuals, the illnesses may range from mild to moderate. However, both Ehrlichiosis and Anaplasmosis can become much more serious, especially in people with weakened immune systems. In severe cases, the infection may lead to widespread blood clotting disorders, multiple organ failure, seizures, or even coma. While death from these diseases is uncommon, it can occur, especially if treatment is delayed or the patient's immune system is compromised. Early recognition and prompt medical attention are therefore essential. So, how are Ehrlichiosis and Anaplasmosis diagnosed? Because the symptoms can mimic many other diseases, especially flu-like illnesses, diagnosis can be challenging. Physicians often begin by performing blood tests. Infected individuals may show a low white blood cell count, low platelet levels, elevated liver enzymes, and abnormal blood clotting. All clues that something is wrong, but not definitive proof of these infections. To confirm the diagnosis, doctors may use a special technique called polymerase chain reaction, or PCR. This advanced method allows for rapid detection of the bacteria's genetic material in a blood sample, providing a quick and accurate result. Alternatively, doctors may look for antibodies to Ehrlichia or Anaplasma in the blood, but these antibodies often don't appear until weeks after the illness begins. Because time is critical, treatment is often started based on symptoms and risk factors even before test results are available. When it comes to treatment, time is truly of the essence. If your doctor suspects that you may have Ehrlichiosis or Anaplasmosis, they will usually begin antibiotic therapy immediately without waiting for laboratory confirmation. The antibiotic of choice is doxycycline, a member of the tetracycline family. When administered early, doxycycline is highly effective. Most patients see rapid improvement and resolution of fever within just a few days. The course of antibiotics typically continues for at least 7 days, and until the patient has been fever-free for at least 24 to 48 hours. Delaying treatment can lead to severe complications, so it's vital to seek medical attention promptly if you develop symptoms after a tick bite or spending time in tick-infested areas. Prevention, as always, is better than cure. The best way to avoid Ehrlichiosis and Anaplasmosis is to prevent tick bites altogether. When spending time outdoors, especially in wooded areas, tall grasses, or areas known for ticks, take precautions. Wear long sleeves and long pants, tucking your pants into your socks to prevent ticks from crawling under your clothes. Use an effective insect repellent that contains DEET or permethrin, and always perform a thorough tick check after returning indoors. Pay special attention to hidden areas such as behind the knees, under the arms, in the scalp, and around the waist. If you find a tick attached to your skin, remove it promptly and carefully with fine-tipped tweezers, grasping the tick as close to the skin as possible and pulling straight out. Clean the area with soap and water and monitor for symptoms over the following weeks. It's also important to know where these diseases are most commonly found. In the United States, Ehrlichiosis is most prevalent in the southeastern and south-central regions, while anaplasmosis is more common in the Northeast, Mid-Atlantic, Upper Midwest, and West Coast. Both diseases are transmitted by different tick species, Ehrlichiosis by the lone star tick, and anaplasmosis by the deer tick, which also spreads Lyme disease and babesiosis. Because ticks may carry more than one pathogen, a single bite can sometimes transmit multiple illnesses. Besides tick bites, there have been rare cases of anaplasmosis being transmitted through blood transfusions or organ transplants. This occurs when a donor has recently been infected or carries the bacteria without symptoms. Such cases highlight the importance of vigilance, especially in healthcare settings. In summary, Ehrlichiosis and anaplasmosis are two serious but treatable tick-borne diseases. They can cause sudden flu-like symptoms and, if untreated, lead to severe complications. Early recognition, prompt diagnosis, and immediate antibiotic therapy are the keys to a full recovery. Most importantly, preventive measures against tick bites remain the most effective way to protect yourself and your loved ones. If you found this information helpful, don't forget to like and share this video with your friends and family. Subscribe to the MediByte channel and turn on the bell so you never miss out on our latest science-based health updates. Stay safe, stay informed, and thank you for watching.